Good morning. Today I'm going to perform the unoccupied bed formation. So, by meaning unoccupied bed, it is a bed that you need to prepare when your patient is going into your ward or your room. So, first things first is I'm going to let you know the equipment that is used for the unoccupied bed. The bottom linen, the top linen, the pillow sheet, and the pillow itself. So first we need to do the things first. First, you need to put your bottom linen. Bottom linen starts from the bottom. So you need to level up the bottom side of the linen in the mattress. Then pull out the linen to the upper side, the head side. And then you have to pull out one piece of the linen and lay it like this. Just lay it on this side. Remember that this linen does not have to be touching the floor, because floor is considered also contaminated and may contaminate your linen. So prevent that from touching the floor. Next is fold your linen to the middle, so that later when you do the other side, it will be easier. Next is tuck your linen inside uh, under the mattress. So tuck it in like this. Then make a triangle formation and tuck this in the bottom of the mattress. So since this is the bottom linen, you need to tuck this is particularly linen in here in all the bottom sides, from the top, tuck in, tuck in. Remember to tuck in the linen carefully, because if you don't lift the mattress before you tuck in, it may damage your linen because of the spring on the bed. Think carefully. Now, we're done on this side of the in the bottom linen. Next, we need to put the top linen. So, remember in the bottom linen, you need to level the bottom side in the mattress. But here, you need to level it in the top side. I'll show you why later. This. Like, like the bottom linen earlier, you need to place down here. Next, you need to roll it in the other side so that you can do it easier way later. Next, you need to tuck this in. Remember the waist. Just lift the mattress and tuck it in. Tuck the in under the mattress. And just like the bottom linen, make a triangular formation and tuck the remaining linen in the bottom of the mattress. Unlike the bottom linen, the upper linen does not have to be tucked in the head side, because this will be considered as the So for now, we're done in this side. So let's move on the other side. Do the things that you do in the other side. Roll the linen carefully so that it won't wrinkle the other side. The show formation will be like this. Next, carefully so you didn't see any wrinkles up there. Tuck, fill in the bottom, lift and tuck. Then, same process, make a triangular formation. Like this, then tuck, and tuck all the way in the bottom. Lift and tuck, and lift and tuck. Then roll up the top linen. Like the other side, do the same thing. The triangular formation. Like this. Lift a sheet. Make a triangular form. And lift and tuck. Tuck carefully that it won't come out. And let it flow like this. Okay. Now we're done at the two linen parts. Next will be our pillow. So let me go this side. On this side, this pillow, you need to locate first the entrance of the pillow where you put the pillow inside the pillowcase. So consider that if this is the entrance, roll it until you make it in the bottom side, then make it like an open sided. Then get a good grip on the pillow, then slowly insert it inside. So there are many things to tuck this inside the pillow so that this won't bother the patient when he or she is sleeping. So mine is, I do it like this. Tuck it in. Nice and tight. So we're done. When this remember always that this open side, not tuck side linen, pillowcase does have to face in the door so that it won't be bad looking to the patient and it will be looking good to them. But like this, so this will be considered my door. So put it like this. So this is called the open bed. So when someone calls you and the patient has to be delayed for some reasons, like it has to be they have something else to comply, yet you do the closed bed so that it won't dirty the top side of the bed. So this is what you call a closed bed. So thank you for watching me perform. I may not be good, but I'll try my best. I don't have much time. This is all I can do. So this time I'm going to perform how the OB bed is put in. So OB bed is performed when the patient is done delivering her baby, and has to proceed in her room. So first things first, my equipment that I'm going to use is underneath pad and an extra pillow with pillowcase. So first things first, you need to put the top linen at the bottom side so that you can perform you can put the the underneath pad on the bed. First things first, put your underneath pad in the buttocks, which the buttocks side reserves. Then this will is the purpose of this is to sanction the liquid that is come from the patients. Next, we'll put the pillow in here so this can support the legs of the patient and will not get numb. So the next thing that I'm going to perform is the post-op bed, which is be performed or placed when the patient when the delivered patient is on her way on the room, and it is being considered to be prepared also. So the equipments that is needed is the pillow, the underpad, urinary bag, suction hose or suction catheter, the kidney basin along with the tissue paper, incontinent bag, the patient's gown, the towel lens, and the rubber sheet. So the first part to be put is the underpad, which is put in the buttock side of the patient. Along with the pillow to support the patient's leg. The patient's gown will be put in there on the top of her head, or maybe where be put on the more convenient to get. Next, put the pillow on the rack that is supported here, but I don't have one, so just put it there. And put your the rubber sheet first before the towel lens. The rubber sheet is put first and then towel lens so that it can suck the liquid from the patient. The padded towel is the kidney basin and the towel and the kidney basin along with the tissue paper will be put in the table where you can reach it easily. Then your suction catheter will be put in the table also and will be taped. You can't touch the suction catheter inside with your hands or with gloves, because this suction catheter is considered is gonna be put inside the patient and it is not allowed to be contaminated. The next one will be the urine bag. The urine bag or urinary bag will be put here under this linen, which is the abdomen level of the patient. So you put the urine bag in here, just lay it here like a swinging thing, and put the tube under here that will be put in the patient. So that concludes my performance on my post-OP bed. Remember, be careful of the things that is not allowed to be touched, and carefully place the things that is needed in the patient's room. That's all. Thank you. The next thing that I'm going to do is stripping of linens, or the linens that I'm going to strip is the linen that patient is discharged or transferred on the other hospital. So first things first is prepare the things that you needed, which is the two chairs that is put there for the purpose of putting the bag of the pillow to be considered as the trash bag. I mean. Next is your alcohol, which is the 7% solution alcohol, ethyl alcohol. And of course, the gloves. You need gloves removing the contaminated linens and the equipments here. So, first things first, put your ethyl alcohol, 70%, and rub gently. And put on your gloves for safety. Next, first things first, remove the linen from the underneath of the mattress, which I'm doing right now. Lift, removed, so that the linen won't be damaged of this on the spring on the mattress. Yes, the bottom side of the mattress. On the other side, lift, pull, lift, and pull. Here also, lift and pull. So the next thing that I'm going to do is first remove this the pillow from the pillowcase. While removing the pillowcase, you need to roll it from inside to outside, and don't let your pillow touch the linens, because these linens are considered as contaminated, and this is also clean because the outside layer only is contaminated. So don't ever let it touch in the linens. So when removing the pillowcase, put your pillow on the other side of the chair and turn this inside out. The outside area is not contaminated. The inside area is the contaminated area, and the non-contaminated area is the outside area. Place it like this. So this will be considered as my trash bin or trash can for these linens. So first things first is the top linen, which is I'm going to roll to the middle. The other side also. When rolling the linen, carefully roll it to the middle so that you can easily roll it out. Roll it later when it's finished. So the next one is the bottom linen, is the procedure which is top rolling, like this. Roll it from the top. Don't let the linen touch your uniform, because your uniform is clean and this linen is considered as contaminated. So don't ever let your clothes touch in the linen while doing this performance. First is the top linen, roll it outside. Then place it in the bag. Same thing. That's the bottom linen. Roll it. And place it here. So sometimes this pillow will be taken by the patients, but sometimes they will not take it. So we put this. This pillow will be placed in the utility rooms, and this contaminated linens and pillowcase will be put in the hamper. So that concludes my presentation of the stripping of the bed, stripping of the linen from the bed when the patient is discharged or transferred on any hospital. So that's all for my performance. Thank you for watching.